Streaming live, this is News 12 Now.
Thanks for joining us for News 12 Now. I am Alexandria Savage, and today we are discussing allergies right at the top of our show because I am one who struggles, and we have an expert from Ochsner LSU here to discuss it with us. Thank you so much for joining us, Dr. Cara. It is a pleasure to have you and see you today.
Yes, ma'am. Thank y'all.
Okay, so let's just jump right in. Is this the peak of allergy season? Where are we? Because I feel like we see pollen everywhere.
It's pollen counts have been pretty high. We are starting to see that things are coated in a nice, lovely layer of yellow. March, April, May, these are going to be the hard months for some patients. And so this is about the time we start seeing people coming in with, runny nose and itchy, watery eyes, sore throat. This is the time.
Absolutely. So what are some tips you may have for our viewers to help combat allergy season? Like for me, before I go to rugby practice, I try to take allergy medicine, but that doesn't always stop the hives.
Oh, yes. Okay. So allergies have varying forms of presentations. You can have limited to upper respiratory with, rhinitis and watery, itchy eyes and the drainage, postnasal drip. Some people can build fluid behind the eardrum. And some people will have more of the skin manifestations, the hives or a flare in their eczema. Those are forms of allergies. And so one of the things that we try to do is kind of get people on a regimen where they're taking something almost daily to kind of manage and prevent worsening of symptoms. One of our mainstays are the once a day antihistamines, and there's varying forms of these that you can buy over the counter. And I get the question all the time, well, what's safe to take with my other medications? And usually those Claritin, Zyrtec, the ones that have been around, tried and true antihistamine therapy, if they're plain, no decongestant in them or anything, not going to affect anything, and they're safe to take once a day. I do tell my patients if they're taking Zyrtec or Zythol, take them at night because they can cause some sedation, but they're great preventatives. The other thing that I like to take or tell my patients to take is the intranasal steroid sprays. Those are great to use for maintenance and as needed. So if I have patients with really bad allergies and they're having daily symptoms even on their antihistamine, then we'll add a nasal spray. And they can use those chronically without the concern for the nasal addiction like the Afrin spray used to cause. So it's one of those kind of things that we hope to try to manage with one regimen, but sometimes we have to combat with a couple different ways with controlling the symptoms. And so the nasal sprays are great to add because you're not starting another oral medication for them, and that's appreciative. And they can use those as, like I said, as needed or as they need to take them daily for their symptoms. And it's, there are different types of triggers for some patients. Sometimes it is being outside. And, my husband's one of those that he has to take his allergy pill if he's cutting grass. And so I tell people, if you have a certain trigger or a certain situation that is going to cause hives or other respiratory symptoms, then you might try a chronic therapy you take once a day, and then something to have on hand if things get more symptomatic while you're trying to complete your daily activities. And then, if you've kind of exhausted your over-the-counter opportunities, we go further and we might try something like Singulair or the injectable medications nowadays. But most of the time we try to manage it over the counter with the least amount of side effects and to keep people as functional and happy as possible through this.
Absolutely. And speaking of symptoms, they manifest in so many different ways. Can you tell us a little bit about what to look out for? Because I know with me it's hives, but it's also like drainage, and then it goes anywhere. It could go from 0 to 10.5 real quick.
Yeah. Some patients, it may be a chronic sore throat in the morning. Most of the time, if that's something that someone's complaining to me about and I'm doing their exam and I don't see signs of infection, I wonder if they're draining chronically down the back of their throat at night. Some patients I've had come complaining of either it's headaches from sinus pressure, or they'll have dizzy spells where there's fluid building up behind the eardrum and it's actually messing with their balance. And so those are some of the atypical things that we think about, have to keep in the back of our mind with allergies. But sometimes it's pretty common: runny nose, itchy eyes, they're red. It can feel like there's sand or something in your eye because it's just really irritating. There's some people may have a reactive lymph nodes because there's drainage happening. The skin manifestations, like we mentioned before, could be hives, or it could be a flare in eczema. And then your asthmatic patients, they may have worse asthma. They may be wheezing more. They may be, waking up more at night coughing, or needing to use their rescue inhaler more often. And those types of situations, you do have to worry about if it's allergies that may be triggering that, especially with the time of year that we're in.